South Africa, considered one of the strongest economies on the African continent, is making slow progress in ensuring children's well-being, and this is according to Save the Children's new report, the Child Development Index 2012, looking at progress, challenges and inequities. The country has fallen 24 places over the last decade. The report also shows that the number of children suffering from acute malnutrition is increasing for the first time in a decade. For more, we're now joined on the line by Madhuri Dass of Save the Children. Madhuri, welcome to Weekend PM Live.
Thank you. It's good to be here.
According to the Save the Children's new report, the Child Development Index 2012, we've dropped 24 places. Take us through these findings.
Sure. This report is something that we take out about, once every 4 years. And what it's showing us is that in the last decade or so, Africa, but one has dropped 24 places. This is in a ranking of countries, which means that we're not making fast enough progress. The report actually gives you a score, which hasn't changed much over time for South Africa. But what has changed is that the other countries are doing better than we are, which is why we are now 24 places lower on that ranking.
But take us through how the study is conducted in terms of how do you then gauge this progress? So what determines this outcomes? What do you look at, basically?
Sure. The study really uses three key indicators, which are the basic indicators for child well-being. This is the number of children in school, under 5 mortality rates, and the number of underweight children. So that's health, education, and nutrition. And each of the indicators is equally weighted. And basically all of the countries get a score based on how they're doing on these indicators. And then they are ranked relative to each other. And that's how you gauge where South Africa is.
So what has contributed to this slow progress, this big drop?
Well, as I said, we're not making fast enough progress. And just to give you some examples of that, our under 5 mortality rates have dipped or stayed roughly the same in the last decade. And if you look at the statistics, for instance, there's 60 per 1,000 live births in 1990 and just 57 in 2010. So that hasn't moved much. You look at the proportion of underweight children below 5, that's remained at about 9% in the last 10 years. You look at primary school enrollment, again, that's just stayed at about 9%. And then if you look at exclusive breastfeeding, which is one of the contributors of sort of under 5 mortality, that's just 8%. It's one of the lowest in the world. I mean, even neighboring Swaziland is 44%.
But does the report identify exactly what's contributing to this?
Yes, it's these. It's the fact that we are not moving fast enough on these 3 basic indicators.
What are your suggestions then going forward? South Africa can adopt to improve the status.
Well, there are multiple causes of child deprivation in this country, and we need to tackle all of them. So whether it's poverty or inequality or the lack of access to good quality services, whether they're health or education services, we have to tackle the high rates of child malnutrition, the high rates of maternal and child mortality. This is a country that's quite badly impacted by HIV and AIDS, and there's a large number of children who are orphaned or otherwise impacted by the disease. And last but not least, there's a number of children who suffer from acute malnutrition, and that's a trend that we found worldwide. So these are all of the areas that we need to make an improvement on in order to go up in the rankings.
All right, and that was Madhuri Dass of Save the Children.